thanks to the OMA for the invitation to speak and to spread this message to your ecosystem. So let's get started. This is an exciting topic because we can have more ability to help people not just lose weight, but sustain that weight loss for the rest of their life and feel good about themselves and have a more joyous and healthful life. So we're all working together, and if we can get started here, we'll talk about how the microbiome impacts with this problem we have with the growing number of obese and overweight in America. And right now, the conventional health authorities tell us it's like 77% of Americans are overweight and over 40% are obese. And by my criteria of nutritional excellence, because I consider a BMI of 24 still being, not health favorable, I would like to use the demarcation line of 23 as a normal weight, because maximum lifespan probably occurs with BMIs below 23, not below 25, which would classify almost 89% of Americans as being overweight. Obesity drives heart disease, strokes, diabetes, cancers, and of course the leading cause of death in the United States. So there's no such thing as a healthy overweight person. All overweight people are insulin resistant because fat blocks the function of the insulin receptor, which then raises insulin production. And excess insulin is a pro-angiogenic hormone. It's a fat storage hormone that also permissively allows other cells to replicate. Angiogenesis means the growth of blood vessels grow to fuel the growth of fat, and in doing so, it could allow cancer cells to glean a blood supply to replicate as well. So it's really just a tremendously beneficial aspect if we could keep our population eating healthier, living healthier, and having thinner waistlines. A marker for obesity and poor health and poor eating is that people have a decreased microbial diversity. In other words, the microbiome has fewer types of different types of organisms. And as you have more plant diversity, plant fiber diversity, more assortment of different plant foods, we're seeing a healthier microbiome. And this obesity microbiome associated with the standard American diet, and the standard American diet, by the way, is 60% processed foods like pasta, breads, salad oil, mayonnaise, donuts, cookies, crackers, breakfast bars, chips, muffins, soft drinks, breakfast cereals. That's 60% of calories in America. About 33 to 35% are animal products. And Americans eat less than 10% produce, with only about 2% being vegetables. So we're talking about this unhealthy diet Americans eat leads to the growth of certain type of bacteria, and those bacteria have unfavorable effects at creating inflammation and exacerbating or contributing to the development of obesity, making it difficult to lose weight, and of course, increasing the flux of calories into the bloodstream, which we'll talk about. One of the findings in obesity and poor health is the bacterial ratio between the two major bacteria types are Firmicutes and Bacteroides. That ratio is increased with increased numbers of Firmicutes in people who are obese. So you have that poor ratio, we have lack of bacterial diversity, and because of that, we have low production of short-chain fatty acids. Now, one particular short-chain fatty acid we talk about a lot is butyrate, because butyrate has powerful anti-inflammatory effects and even effects to protect against colon cancer. But butyrate has another role besides its anti-inflammatory effects. It also has a feedback loop in between the apostat and the hypothalamus, because butyrate creates a feedback loop that tells us we're satiety or we're satisfied and we eat less calories. So we produce more butyrate when we're eating more fiber and resistant starch. And therefore, fiber and resistant starch become a controller of butyrate production. Now, when we eat foods that do not contain fiber, like white flour and sugar, for example, they rush into the bloodstream more rapidly. So that's called the glycemic rush of how fast calories enter the bloodstream. And there are two foods that give it this caloric rush, which creates a huge amount of calories loading the blood. And that's predominantly animal fats, oils, because the fat enters the bloodstream so rapidly, and sugar and high glycemic carbohydrates. Those combinations give this high caloric rush. Whereas instead of using oil and animal fats as a source of fat, If you use nuts and seeds or avocado as a source of fat, the fats into the bloodstream is much slower, 1 or 2 calories a minute compared to 40 to 50 calories a minute. That's what I'm saying, 30 times the speed that oil goes into the bloodstream, at 30 times the speed as eating, let's say, a walnut versus walnut oil. So therefore, that big caloric rush entering the bloodstream stimulates the dopamine centers in the brain. And over time, we become more dopamine sensitive. Those are the same dopamine centers in the brain that are stimulated by opiates and narcotics. And over time, we get addicted to, dependent on, and desirous of this caloric rush. And then we're not satisfied eating an apple or having a bowl of vegetables or whatever it is, and beans, because there's not enough calories coming into the bloodstream at one time. Even though you're eating enough calories, even though the calories may be meeting your caloric needs, but they're not satisfying the brain's need for a caloric rush of concentrated calories. So we're saying here that the unhealthy bacteria, as a result of unhealthy eating and becoming overweight, facilitates and magnifies the caloric rush. And of course, in response to that caloric rush, we have an increased insulin response, which then is a primary fat storage hormone. And then, of course, we know such a major part of the American diet is white flour, like bagels and bread and pizza and burgers. And I'm saying white flour is the same as eating sugar because it goes rapidly into the bloodstream. It's high glycemic carbohydrate. There's not much biological difference between eating white flour products, eating sugar right from a jar, or in candy. It's almost like a drug because food contains nutrients to sustain life. And the nutrient content of sugar in white flour is so low that it doesn't even have enough nutrients and cofactors for the body to turn it into energy. So it has anti-nutrient effects, utilizing the nutrient stores in the body to convert it to energy, and its inefficient production of energy makes more of it shunted to fat stores. So we're going through some reasons why nutritional starvation as a result of eating foods that do not contain antioxidants, phytochemicals, and vitamins and minerals, foods that do not have a significant micronutrient load, leads to overeating behavior because of obviously stimulating opiate receptors, leading to cravings, dopamine insensitivity, which leads to us having more desire to overeat food to get the same stimulation. And then we start, obviously, because of that, we're saying the primary, you could say drug addiction in America is eating junk food and fast food and commercial baked goods. And that leads us to have a life that's involved with living to stimulate the brain. And by the way, there's a correlation between commercial baked goods and fast food and depression. Studies show even 2 or 3 servings a week increase the risk of depression significantly in a dose-dependent manner. And many Americans are eating 10 to 15 servings a week of commercial baked goods and fast foods and fried foods, which keeps them universally dysthymic. And the word dysthymia means that they're not totally depressed, but their life isn't that exciting. They have no passion and joy of living. They live mostly to work so they can make money, so they can go to the bars or go to the fast food restaurants or go eat fast food or junk food. They live for their diet, and they have so what I'm saying is that food addiction has a weakening effect on our ability to appreciate the outside world and be, you could say, grateful for or seeing the world outside of ourselves in a way with passion and excitement and joy. So the more you're an addict, the more you're involved with meeting the brain's narcissistic needs for addictive stimulation. And people can find much more joy when they get healthier and restore the full mental function and creativity to the brain that addictions steal away from people. So we're talking here about, right now we're just reviewing foods that the Americans eat that create this addictive relationship with food, and particularly eating fried foods. And foods, when you heat in oil, you cause rancidity and other toxic compounds that are pro-inflammatory and have been linked to autoimmune conditions like inflammatory bowel disease. But they're carcinogenic, and even working in a fast food restaurant and inhaling the fumes can be unhealthy for the lung, for example. But of course, these are a contributor to dysbiosis, as well as obviously eating processed foods. The way Americans eat, we're doing a lot of things that create unfavorable bacteria that create more toxic compounds. For example, it's not just heated foods and fried foods, but also grilled, barbecued meats and animal fats lead to more gram-negative bacteria and more production of TMAO, trimethylamine oxide, which is a pro-inflammatory substance that accelerates atherosclerosis by inflaming the interior lining of blood vessels. So when we're eating, when we're overeating and we're eating more calories than we need, and I'm saying there's a direct relationship here between the lack of micronutrients, phytochemicals, and antioxidants in the diet, not meeting our micronutrient needs, and our desire to overeat calories now. So we have a unrelenting desire to overeat calories to break that cycle. And it's hard to do that when the body's nutritionally deficient, eating so many processed foods. And then you obviously have all these dried crackers and pretzels and junk food with their acrylamides that also have negative effects on promoting the favorable bacteria in the gut. So this unfavorable milieu leads to more inflammation in the gut, more weakening of the gut lining, and of course we call it leaky gut, and we're talking about sealing the gut, and the sealing of the gut means that we slow the absorption of calories into the bloodstream when we seal the gut with a healthy coating of bacteria. And of course, I'm saying here that the human stomach is only about a liter, and you don't feel that the stretch receptors don't signal satiety when we're eating like processed foods, oils. But of course, when we're eating vegetables and beans and things, natural plants, they fill up the stomach with lower levels of calories, and it plays a role in making people be satisfied. So they don't have to eat thimble-sized portions of food to be on a diet. They can eat robust portions of volumes of healthy food, trying to chew them very well, which then, of course, mixes with the bacteria in the mouth, creates nitric oxide, and stimulates the growth of good bacteria. So people at our place we have a place where people come to learn how to eat healthfully and to recover from food addiction and diabetes and heart disease. And they find they're eating nice portions of delicious meals that are filling, and they don't feel they're on a diet, and they can go home reduplicating what we do here. And obviously, we're giving them salad and also nice dish, cooked vegetable dishes, and even desserts made with fruit that mark the end of eating for the day. So, in other words, there's a method to the madness in making people feel satisfied, so they don't feel they're on a diet, and they can still feel they're eating all of the food that makes them feel comfortable. Now, fibers and resistant starch are particularly important. We're talking about in regulating the metabolic pathway associated with obesity, and we want to establish a high fiber diet so these healthy bacteria grow that are fueled, and because the fiber is the prebiotic to these healthy probiotics, and then that leads to the bacteria that break down the fiber and resistant starch into short chain fatty acids. Means, for example, that when you eat beans and other legumes like peas, they're so high in these slowly digestible carbohydrates that don't flood the body with a glucose surge. But they're also highest in resistant starch. And resistant starch is resistant to enzymatic degradation. So now, instead of being broken down, the starch into glucose, the starch is broken down, or you can say degraded by bacteria, and forms fat, these short chain fatty acids. But that happens so far down in the digestive tract, in the distal portion of the small intestines and proximal portion of the large intestines, that 90% of those short chain fatty acids are lost into the toilet bowl. They have anti-inflammatory effects in the colon, preventing colon cancer. That means when you're eating 200 calories of beans, you're not really getting 200 calories in. It felt like you ate 200 calories, right? You shut your satiety index down by 200 calories, but maybe only 170 calories come in, or 160 calories, because the resistant starch, which is marked as calories, passes through into the toilet bowl as short-chain fatty acids. Now, the 10% of the short-chain fatty acids that are absorbed as butyrate or stimulate two important factors here. They stimulate the GLP-1 hormone receptors, which can then, obviously, the GLP-1 slows gastric emptying and makes people feel more satisfied, but also the butyrate is a major signaler of the apostat in the hypothalamus. So it's able to tell us so we have the apostat in the brain and the appetite in our stomach, stretch receptors. We have a lot of different mechanisms which not only slow gastric emptying and make us feel more satisfied with the meal, but also keep us sustained between meals. So we're not feel like eating again a half an hour later, and we feel like we're not hungry already. So overall leads to a lower caloric load or a lower desire for calories through the whole day. So we're talking here about choosing the right foods and the right prebiotic and probiotic supplements that can help a person feel more satisfied with fewer calories. Now, we can use some supplemental ingredients, because these antioxidants, phytochemicals, also have beneficial effect on gut bacteria. So we're talking here about, the maybe adding resistant starch from potatoes, or we're talking here eating these complex carbohydrates that have more slowly digestible carbohydrates, the lower glycemic carbohydrates, and then if and green vegetables, right? And some are green vegetables, including like things like artichokes and asparagus, intact whole grains, right? The intact whole grains that are cooked in water, not ground into a flour and baked, that have beneficial effects. Of course, we're talking about legumes and beans that have the most resistant starch, and of course, um, and cruciferous vegetables or cruciferous vegetables powders have beneficial effects. And what happens is now when we have these prebiotic substances, we have more increasing of the favorable bacteria, particularly the bifidobacteria and the lactobacilli and the fecali bacteria, but also more resistant starch. Um, especially when you're chewing very well, these mixture of green vegetables like arugula, having the oligosaccharides and the quercetin from the onion family, like scallions and onions, garlic, all these things have beneficial effects at producing these beneficial short-chain fatty acids like butyrate and propionate and acetate, which all have anti-inflammatory effects on the gut wall and effects on the gut wall to keep a healthy microbiome and a healthy biofilm. And the thickness of this biofilm that covers the villi has the effect now to slow the absorption of moderate glycemic foods. Like when you have that oatmeal or the mango for breakfast, the question is, how do we turn that moderate glycemic food like a mango into a low glycemic food like a strawberry or a bean? And the answer is, well, we regularly eat these foods that protect that thicken the microbiome, like green vegetables, like onions, like beans, and beans are cooked, and mushrooms, of course, that have beneficial effects at helping us protect and have a healthy microbiome. So we have an anti-glycemic load microbiome, which then slows everything we eat into the bloodstream. And the slower the calories into the bloodstream, the more sustained energy we have, the less we have to store fat. In other words, when the fat rushes into the bloodstream, 300 calories at one time, the body can't burn it for energy, it has to store it as fat. But when things go into the bloodstream slowly, the body can preferentially burn it for energy and not turn on fat storage. So just here we're scoring carbohydrates on a hierarchical scale of quality, demonstrating that from flours and white flour and potato and pasta being very high glycemic, but they're also relatively low in resistant starch and fiber compared to peas, lentils, and beans. As you can see, the resistant starch is extremely high in peas, lentils, and beans. And if we add up the resistant starch and fiber content, we see that not only are their calories are not absorbable, but they're a great prebiotic to build. And sometimes people will get gas because they don't have a buildup of the healthy bacteria to digest these foods. So that's why we may have to start with some smaller amounts, chewed real well, but not removing them from the diet, just having with smaller amounts so they're not too uncomfortable. And then they gradually can increase the amounts of beans which they eat. I recommend people have beans or legumes or black lentils or little chickpeas or split peas at every meal, like even if it's just a tablespoon at every meal, to start to build the growth of the healthy bacteria in the gut so they can better able to digest these foods over time. They're a great source of carbohydrate and make great healthy dishes in them. Okay, so we're talking here about these foods that scientific studies have demonstrated have powerful anti-cancer effects. Interestingly, are also the foods that favorably build the microbiome. So we're talking here about this acronym G-BOMBs, G-BOMBs, greens, beans, onions, mushrooms, berries, and seeds. I mean, many people are aware that like flax seeds and chia seeds are rich in lignans, have anti-estrogenic effects, lowering rates of prostate and breast cancer. They also have tremendous prebiotic effects, and shown in many studies to extend lifespan and reduce cancer and reduce blood pressure, for example. So these foods have multiple medicinal effects on the body, and we're trying to have people eat these healthy foods daily or almost daily as a major part of their caloric intake. So scientists call this the second meal effect. The second meal effect means that When you're eating your breakfast or your dinner the next day, you're benefiting because you had the greens and the mushrooms and the onions the day before. In other words, it created such a healthy microbiome that slows the absorption of glucose that when you have something that's more of a higher glycemic food, it reacts like a low glycemic food because your microbiome is so healthy. So that's what scientists call the second meal effect, and that's what we're trying to achieve. We're trying to achieve the maintenance and consistency of a healthy microbiome, and by measuring it and having people supplement intelligently, remove microbiome destructive foods, and increase the foods that build the microbiome, we have the armamentarium and the tools to demonstrate to patients what's not working and what is working and how we can build back a healthier state to them. And with this direction, it's very motivating for them to see it in writing and see to not just to understand why they're not getting results with their diet and how to have them get good results. So we're talking here about building back using these foods. And I want to emphasize that lettuce is a superfood because it's not just eating we want to have a salad every day and chew it super well. And we want to mix in some lettuce with some cruciferous green vegetables like arugula or bok choy or kale or some, we want to, and have, of course, little onion or scallion in there too, with maybe a dressing made of nuts and seeds. But of course, I want to just emphasize that people don't recognize lettuce as a superfood because lettuce is the richest source of sulfoquinavose, a major fuel that fuels the growth of healthy gram-positive bacteria in the gut and helps build that microbiome and biofilm. And lettuce is the lowest oxalic acid of all greens, means all the calcium in lettuce is 100% absorbed. So there is increasing this low-calorie food in our diet and trying to eat it whenever we can, scattered through our meals, is very, very important. When you eat these green vegetables, particularly green cruciferous vegetables, it also supports the growth. It stimulates the aryl hydrocarbon receptors, which stimulates the growth of the intraepithelial lymphocytes that surround the villi or live under the villi in the small intestines. These are the defenders at the gates of the castle, meaning they monitor what goes in our gut. They monitor what passes through into our bloodstream, including viruses and toxins and bacteria. And so we're talking about tightening up our gut, making it more resistant, not so permeable to toxins, resistance against infection, right? Resistance against taking in, getting seriously ill. And we know that fat on the body, of course, leads to more pro-inflammatory state, leading to a cytokine storm because fat cells have a poor blood supply, and they release reactive oxygen species, cytokines and lipokines. And I'm saying here that when you're losing weight, as you're losing weight, it inhibits the release of cytokines and lipokines from the fat supply. And as you're losing weight, even though you're still overweight, it starts to reduce the production of estrogen. It starts to have anti-angiogenic effects. And we start to see protection of health even before the person lost all their weight. And we can, even in their moving in the right direction, the diabetes is improving and in many cases going away. I see here at my retreat in San Diego, type 2 diabetics, 75% become non-diabetic within the first month. The first month. They're on their diabetes for a decade, and it's a process that caused them to develop a pathology, and they're still not even lost all their weight, but when they're losing weight and eating so healthfully, it's amazing how fast their diabetes goes away. As a matter of fact, I wrote a study on this showing a deprescribing study with 10 other physicians on how to deprescribe diabetes medications when people are on a diet so aggressive to reverse diabetes. And the point we were making was the doctor has to really be vigilant to be on top of the right speed of medication reduction to prevent hypoglycemia because diabetes type 2 can reverse so rapidly when we do all the right things. And one of these right things are supporting the growth of the aryl hydrocarbon receptor through the consumption of green vegetables. We're a green vegetable dependent animal. We can't have normal immunity without eating sufficient green vegetables. That's why I say to people, if you don't like green vegetables, you better live close to a hospital. But it's like a stupid joke, it's not going to really help anyway. But it reminds me of when I like to go skiing, we see all these people living on the ski slopes, wanting to live right on the ski slopes. They can go down and take the lift right up, right from where their living rooms practically. And I'm wondering why it's like within America, we'll have so many sick people eating junk food and fast food, but my people just live all right around hospitals. They can take the trams or the lifts or the zip lines right into the emergency rooms or into the doctor's offices because their medical care involves their whole life. And we have this unprecedented opportunity in human history to have great health and resist these diseases that are the result of nutritional ignorance. Okay, let's move on and stop, get off the soapbox and talk about we're reviewing this concept that that chronic inflammation and the buildup of toxic metabolites in the body, like reactive oxygen species, like advanced glycation end products, like lipofuscin and ammonia and uric acid, we build up these pro-inflammatory compounds, TMAO, from what we eat, and we create chronic inflammation, which ages our body. And the aging body then is more prone to, obviously, weak muscles, fatigue, brain fog, all these things before we get, cancer or heart attack or stroke, which are also, largely preventable. And the main cause of disease is what we're eating. These refined carbohydrates, these high glycemic processed foods, a diet high in saturated fat, fried foods, sweets and added sugars. Of course, red meat, particularly the way it's cooked, which gives us too much heme iron. The iron levels get too high. Carnitine, and which can drive the production of the unhealthy bacteria. The new 5G, which is a pro-inflammatory substance, and I'm also suggesting this increases IGF-1. We eat too much dairy and meat, too much animal protein, we get excessive production of insulin-like growth factor 1, IGF-1, and higher numbers of IGF-1 are linked to aging of the brain and promotion of cancer because it's a growth-promoting hormone. And of course, we throw onto that excess sodium, which then causes irritation and inflammation to the interior lining of blood vessels. And our lifetime exposure to sodium doesn't just affect our blood pressure, but it weakens the interior lining of blood vessels, increasing the propensity for the blood vessels to crack or split and cause a hemorrhagic stroke. And then, of course, we throw alcohol on top of that. All these things create the chronic inflammation in this, you could say, diet we eat in America that I say is designed by Al-Qaeda, one of my jokes, that was just designed to damage people. So to review and to summarize this message, we're trying to utilize these tools to be able to motivate and educate our patients that recovering from diabetes and obesity and being overweight is not as difficult as they think. The taste muscle can change. We can teach them healthy recipes, and they can find that it's easier to recover and see results that are dramatic and reinforcing to their motivation, because this really works when they have the right tools and start to have the right support. So we're talking about the importance of short-chain fatty acids being in that zone of benefit, right? Not too little, not too much, right in that zone. And we get that obviously by improving this functional biofilm. And we can help people when they have bloating and gas and they feel like they can't eat healthy foods. One of the ways we can aid their digestive ability is with the right food supplements or supplemental pre and probiotics. And we also are avoiding pathogenic microbes, gram negatives, too much E. coli, and things that can cause urinary tract infections and other negative effects, because the more of the negative pathogens and bacteria and yeast you have, the more difficult it is to lose weight. So we're also putting all this together, that the nutrient diet in conjunction with the judicious use of supplements, including improving the omega-3 index, right? The judicious use of supplements to increase tight junction integrity, to enhance intestinal cell differentiation and variety, to normalize and the body's signals with the GLP-1 and leptin and butyrate and all these factors that control and give people normal signals to say that they eat enough food. Most primitive societies and most rural areas around the world, where people consume between 1,400 and 1,600, 1,700 calories a day, whereas Americans eat around over 3,000 calories a day. We're eating way too many calories. We're driven to consume too many calories because we're not satisfying our body's needs with these biological signals that we had enough food. When you eat poorly, you become like a calorie-consuming monster that can't be controlled, and the biological urge to overeat calories is too strong. And we can take away that urge to overeat So now people are put back with their instinctual drive to consume the right amount of calories. I say, I make this other joke and I say, half of what we eat meets our needs, and the other half meets the needs of our doctors. And you know what? It's like getting people comfortable to eat the right amount of calories means they have to eat a lot of good, healthy food and have a good, healthy gut microbiome to be satisfied. So we slow glucose absorption, we accelerate, we keep their glucose low, which means their insulin secretion is low. They don't need a high insulin secretion. They can immediately start to have their diabetes medications reduced. And we don't want people taking diabetes medications that push the beta cells in the pancreas to produce more insulin, which they poop out even faster, or even giving insulin, which makes people increases their appetite and makes them get more overweight and more diabetic. We want to get these people off their medications as fast as we possibly can because they don't need them anymore when they live in a healthier manner. So it's so exciting to be able to say to people with type 2 diabetes and obesity, you can lose your diabetes, your high blood pressure, and you're being overweight, and you can do so in a way that's rewarding and effective. You can lose, the first month, the average person may lose 10 or 15 pounds a month. You can, in the second month, maybe 8 to 10 pounds a month. You can sustain a rate of weight loss that's exciting, that makes doing this worth it. And we can immediately see a change in how you feel and and protecting your health. So this is exciting information. It gives people the ability to take control of their health destiny. And testing the microbiome can aid in convincing a patient and motivating them to make these changes. So we're establishing a baseline to guide the recommendations. We're enhancing motivation. We're monitoring their progress. We're enhancing their confidence in the recommendation of the physician. We're seeing improvement in lipids and glucose and how they feel immediately. And now they're going to, of course, feel better about their brain fog is going to go away. They're going to be able to think more clearly. And there might be a temporary period when they're just starting when they feel worse the first few days, but soon they're going to start to feel better and have more mental clarity and more at peace with themselves. And of course, with precision guidance can aid in the dietary recommendations and the supplements we recommend to them. And now I'd like to introduce Dr. Z, who's going to continue on this discussion of how she is able to help patients and teach and motivate them to make favorable changes to build back good health.
Hello, everyone. Thank you so much for having me, and thank you so much, Dr. Fuhrman, for the introduction. I would like to talk to you as a clinician, as someone that is in front of the patients again and again, and that for the last 20-something years of practicing medicine have been frustrated seeing that every time that I have an obese patient, my 15 minutes appointment and the healthcare system the way it is does not allow me to do or provide the appropriate care that my patient deserves. And how this frustration has been actually a point for me of change as a physician, and a point for me to bring creativity and bring modern medicine, what I call modern medicine, to be able to provide this comprehensive approach that I believe that will help so much our patients. Let me start saying that we have been treating patients based on their BMI or the body mass index, and even using the waist circumference and the fat percentage, something that has been more and more during the last decades, in some way controversial because does not provide us all the information that we need to use to favor our patients. Many studies, especially in the elderly population, as a geriatrician, I have a special interest in that group, have demonstrated that the BMI does not represent a fair way to evaluate obesity and also comorbidities or risk for comorbidities in elderly patients. And now we are seeing something very similar in the youngest population. So using these metrics may be a good format for us to do a screening, but should not be the only thing that we do, because obesity, as Dr. Fuhrman already mentioned, is not as simple as having extra fat in our body, but really is a very complex medical condition that involve more organs and even our brain and our neurotransmitters in the body. So we need to see it in this holistic way. I like to use in my practice the Edmonton obesity staging to bring these extra components to the health of my patients. I try to see my patient, my obese patient, not only based on the BMI or how much is his weight or her weight, but also to consider the aspect of the medical, mental, and functional condition. Uh, as Dr. Fuhrman mentioned before, being overweight may not be something that we find very concerning because of numbers, but if being overweight already means that we are having elevation of our glucose levels or our cholesterol, or we are already having high blood pressure, or these conditions are already affecting our mental health or our function, these numbers per se, again, the weight or the BMI, are not enough to show the magnitude of our problem and the risk that our patient is facing, or the quality of life, the magnitude of how much the quality of life is already affected. So this approach where we see the patient in a comprehensive way allow us to understand the real condition and the real opportunities that we have in front of us. As Dr. Fuhrman mentioned before, obesity is not only per se a medical condition, but really is the first step for many other medical conditions. And it's the beginning of a cascade of negative events that could move us towards not only morbidity, but to lack function, uh, affected quality of life, and of course mortality. And we need to understand that when we have someone in front of us in our clinic with obesity that didn't yet um, express any other medical conditions, is probably the best time that we have and the opportunity that we have to start working with them, to not procrastinate in taking care of them, because we are at the point of primary prevention. We can really help those patients to improve their life and to improve their well-being short term and of course long term too. Many of us, we have been told that we need to start with basics, and I completely agree with that, and I reinforce what Dr. Foreman says. Appropriate diet and of course exercise should be a step one when we face a patient with overweight or obesity, or when we see any metabolic pattern that is negative and that could be improved by this. But the reality is that majority of us in this system, we are in front of appointments that are 15 minutes, and we are not really educating appropriately our patients. Saying do exercise or do diet is just not enough. Many of our patients don't know what we are really suggesting, don't have the literacy to understand what we are recommending. So using other members of the team, nutritionists, physical therapists, or other systems that could provide patients with more information, high quality of information, and with this continuous follow up and encouragement and coaching so they are successful in this plan is fundamental. 15 minutes are not enough, and are not enough for the obesity, but will be even less satisfying when we have already diabetes, high blood pressure, sleep apnea, and etc. So we need to be very cautious and not just simplifying the process of go exercise and eat well. This is more complex, as you noticed when Dr. Furman was claiming the positive effects of food. We can use them on the favor of our patients. The second simplistic approach really has been for us, and especially right now during the times of GLP-1s, on relaying everything to a pill or an injection. And this truly has been showing during decades that we have not been able to have positive effects that are sustainable. That magic treatment does not exist yet in a pill or an injection. And this is even more complex when we think about not only the side effects or the interactions that these medications have with other medications or treatments that they are receiving, or but when we think about the price that we need to invest on getting these treatments, and more those values are getting higher and higher. So this is really, we are in a point when health is really separated, or the opportunity of health is separated by how much you can pay, because even insurances are not necessarily covering for this. The big problem with these pills is, again, that sustainability depends on being on those pills or those injections for almost ever, if not ever. And not necessarily we have yet available what will be the side effects of these medications if we take them for 10 or 20 years from now. So just relying on something that is not necessarily uh, accessible for majority of our patients, and that has side effects, and that is very expensive, and that we don't know yet long term, is truly risky and probably not the best way to take care of our patients. I am not saying that these medications may not have an space and that they don't need to be used. In some cases, yes, but not alone, not as the only way to treat patients, and of course, not long term. So now we are in the situation where we ask ourselves, so what now, and how do we help our patients when the typical approach, right, that we see in the clinical environment that we have right now and for the last decades has not been appropriate and has not been really effective. Uh, and I believe that, again, creativity and using evidence based medicine and being open minded and being out of the box is our answer today. Insanity is defined by trying to get different results while we practice exactly the same things, right? And we are right now in a point that we as physicians in front of patients with metabolic diseases and obesity, we are practicing insanity. We are not getting results. And as it was mentioned before, the mortality associated with it is super high. And in the US, the cause number one of death is cardiovascular disease. And we know that the what precedes the cardiovascular disease in many, many cases is obesity and metabolic disease. So we need to really target it as soon as possible. Going back to what was mentioned before, and right now, just as a kind of a reminder, we have new information. We have updated information that majority of primary care physicians that are the first ones to be in front of patients are not considering or don't have yet available. We know that our gut flora is important to define how is our quality of nutrition, how is our metabolism working, and of course, as a result, how is the quality of our life, our health, and our weight included. So ignoring that right now and don't taking that in consideration when we establish a plan of care for patients is truly reducing the opportunities of our patients. So now that we know the effects, the positive effects of a good, positive, balanced flora versus the opposite, it's again an opportunity that is in front of us to try to benefit our patients with something that will be in many ways benign, less expensive than many of the medications that are right now in the market focused only on obesity, and that will also improve not only the weight of our patients, but will help with many other aspects of the health of our patients, because we know right now that this gut flora is not only influencing our weight, our metabolism, but is also related to other type of medical conditions that are related to inflammatory diseases and even with mental health. So again, focusing on this and trying to find a way to incorporate this in our regular practice is fundamental and is what I believe best practice of care. And this is really not so new, even for many could be new. This has been already as part of the science and as part of our research for a few decades at least. And this is an example of studies done in the 2010 and 2016 where we were already seeing the effects of using different type of probiotics or probiotics mixed with prebiotics and how this affected in a positive way the weight of our patients and even the waist circumference, right, which marks our central obesity and the fat percentage. So this has been already in front of us for long term available to be used. This study, for example, just to show you some graphics, was published in 2016 and was using specifically lactobacilli and bifidobacteria to reduce body weight and improve well-being. And we can see in the four different graphics here that this had a positive effect not only in the body weight body mass in general, but also in waist circumference and in the BMI per se. So thinking about how much is the effect, just using for 3 months prebiotics, appropriate prebiotics, imagine how good this could be if we fix the balance of our gut flora and we maintain this for longer time in an appropriate way. I want to bring a little of science behind the clinical aspect of this, just to kind of incorporate this combination of we know the science, what happens right in our gut, we know what happens at the cellular level, but I want to transmit what happens in the patient, in the real life. And this is a clinical review with more than 46 studies where we are trying, or the study was trying to show the effect of probiotics in obesity and overweight patients. And as a conclusion, what they were able to see, not only that, of course, it has an effect for in the BMI and in the body weight, but if you use it for longer time, the benefit will continue. Using a mixed flora strain will be more beneficial. And this added to the use of prebiotics and of course diet and physical activity has even an enhanced effect. So we can see exactly how this is recommended to be used. It's not just randomly to use one prebiotic, but it's really to make sure that this is part of a protocol that is appropriately done and based on education and in science. This is another study that actually was published again 2016, and what they found as a review, it was a clinical review of several studies, is that probiotics are safe, that are very well tolerated, that we can use them long term, and that the reported adverse effects are really benign and they can be improved through time, right? And again, that the benefit can be seen on improvement of the body weight, improvement of the fat metabolism and the glucose metabolism, improve the insulin sensitivity, and reduce chronic inflammation, all related not only with obesity, but with metabolic disease and in general with our quality of life and our complete physical well-being. Another, in this case, systematic review and meta-analysis, and I like this because this involves several studies, so it's a very comprehensive review that was published more recently, in this case 2022 and 23, and you can see that after reviewing the effects of probiotics, we can see that now the total cholesterol improved, triglycerides improved, and the LDL, which we always call the negative cholesterol, is also affected in a positive way. No changes in the HDL in this case, but at least the big important negative effects of our cholesterol, our triglycerides, are showing a reduced value, which is so important. And again, not only the weight, but we are talking about the comprehensive results that we see in patients that have metabolic conditions. Other meta-analyses with 18 articles, 800 participants, and they again show that probiotics improve triglycerides, total cholesterol, LDL, and using more than two species of probiotics actually had a better effect that was significantly statistic in those levels. So again, it's not just randomly picking one species of my probiotics, but it's doing the appropriate mix of them to bring the value to the patient. And you may be asking right now, okay, I am in front of my patient, and I want to start doing this. How do I do it? And I will tell you, I have been there, and I remember going to different stores where they have these big walls of confusion, and that means a lot of brands, a lot of flavors and colors. One are gummies, powders, of course tablets, and beyond, right? And I was trying to select one probiotic, not only for me and my family, but really to recommend to my patients. And I felt so ignorant in front of this world of confusion, because not only that the prices were different, the color were different, but I was not able to understand which one do I need to pick, which one will be good for my patient, is any side effect if I pick the wrong one, and how do I get this done correctly? And you probably have been or will be in that position, if you and when you start providing this recommendation to your patients to add probiotics to their treatments, right? And the truth is that we don't need to get into insanity again, and we don't need to fight against confusion, because the technology is there. And again, it's I what I love more about medicine is that it's not a static, that is an open door for so many new things. And we have more and more technology. We cannot keep practicing like 20 years ago or 40 years ago when we didn't know. Now we know, now we have access to knowledge, we have access to technology. So knowing that we have access to testing, appropriate testing, high quality of testing that will allow us to not only identify all the different species that a patient and a specific unique patient has in as part of their gut flora, but we will be able to find out about the specific composition, if there is balance, which type of flora is more prevalent in that person, which one is missing, and not only allow us to know the today and the how and the what and the why, but allow us also to see this patient progressing long term when we are doing the right treatment, when they are doing the appropriate diet, and when they are changing lifestyle, so we can use this as a baseline, and then we continue following patients to see their improvement. And this is absolutely valuable for us. So we understand that each patient is a complete unique case. Not all of them will have the same flora, no matter if they have the same age, if they live in the same country, if they have the same gender and the same medical conditions, because each of them has been exposed to different diet, to different treatments, to different antibiotics in their life. So we cannot assume things. We need to test, and we need to identify what is happening to our patient and why this is important to be treated, and again, why and how we can get balance again in this flora, gut flora of our specific patients. So we can see that normally what will happen is that we will recommend our patients to get tested. The stool will be sent to a laboratory, and the laboratory will be able to, by different type of molecular testing, DNA testing, to see the characteristics of the gut flora, which are the more prominent bacteria that are present. Are they good ones? Are they bad ones? Are they just variable? Are they probiotics? And are they in the right proportion for our patient? Based on that, you can get a score that is an initial score that you could be actually following through the process to see that it's improving, but also you will be able to compare this with the symptoms because a clinical survey will be provided to patients, so you can merge symptoms, the clinical aspect, with the laboratory aspect. So you again you are not treating a laboratory result, you are treating the patient, unique patient that you have in front of you, and you are providing after that, based on precision medicine, the treatment that is unique for that patient, that will have a specific species as part of the probiotic. If you decide to add prebiotic, specific prebiotic combinations, to make sure not only that the bacteria will be in the body, but will be also feeded by the probiotic to make sure that it's maintained in your body in a balanced way, in a way that will improve your obvious symptoms, right? That could be gas or could be distension or your weight, but also the not so obvious symptoms like inflammation. And as we mentioned, this chronic inflammation really is big part of our long-term cardiovascular risk, cancer risk, and even symptoms of mental health disease. Again, as part of the information that you will be able to receive, you will be able to identify the three more important conditions related to this abnormal weight gain or obesity. So you will be able to target these specific markers to make improvements, not only through the probiotic and prebiotic, but also through the diet and through other recommendations that you could add as part of your complete protocol to treat your patient. But even as important as that, you will be able to educate your patient. Your patient will have in front of them appropriate, high quality information, valuable information, so you can empower your patient. I always say that knowledge is power, and that's exactly what you are doing. You are incorporating your patient as part of the team. Now they know what is happening in the body. Now they know what they need to do to improve these conditions. So they are responsible, they are accountable, they are engaged in their own care. And that is a big part of receiving or seeing a positive outcome. So, trying to summarize more or less all the things that we mentioned during this seminar, and trying to bring these takeaways with you. Obesity is not as simple as it looks. This is not just the result of overeating. This is a complex condition, a medical condition that requires a very multidimensional and comprehensive approach. This is not just about stop eating. This is not just about inject something or take a pill. This really needs to be seen as a complete panoramic of what the patient is going through, where we need to incorporate not only the medical aspects, but also the social, emotional aspects, the cultural aspects. And of course, we need to use evidence based medicine to do the adjustments that patients need and deserve to be successful, long term, sustainable, successful. The second thing that I believe is very important to remember is that our gut flora acts as the gatekeepers in our gut, right? And they are the responsibles of paying attention, what is going on here, what is trying to come inside of our body, what is causing inflammation, and to digest it, process it, and again, kind of triage what will go inside of us. We are not plants. We do not develop our own chlorophyll, and we don't develop our own substances in our body. We depend of what we eat to produce our neurotransmitters, to produce our hormones in our body, and at the same time to produce inflammation. So the positive and the negatives come from our gut flora, and our gut flora as, again, the system of triage. If we don't have an appropriate flora, if we don't have enough amount and enough diversity, we will be missing the opportunity to have these doors closed for what is not appropriate for us and the doors open for what benefit us and our body. The third thing that is important is that the diversity of our gut flora is important. And as I mentioned, if each type of bacteria has a specific taste for different type of foods, we need all the diversities of each of them will be specifically targeting a specific type of molecules and specific types of fibers and food and etc. If we have only one type or just a few types of these bacteria, we will not taking care of the other type of food that we are incorporating to our diet, and therefore we are missing the opportunity of really helping with that, and we will be predisposing our body not only to metabolic disorders as obesity and diabetes, but again as chronic inflammation and therefore mental health diseases and even cancer. And last but not least is, again, we are right now in 2024. We have access to so many new things, amazing technology, amazing information, lower prices than probably a few years ago and 10 years ago for sure. So we have access to a new way to treat our patients. We need to be curious, we need to be proactive, we need to be alert and trying to investigate what is there, what is available, so we can incorporate these new technologies, these new opportunities to help our patients. The reality is that we are good doctors not when we have a great diagnosis or when we order the fancy expensive test or the fancy expensive medication. We are good doctors when we are able to bring good outcomes to our patients. If our patient fails, we are failing with them, because it's our responsibility to create a plan that is unique for the needs of our patient, that is appropriate, that is feasible, that is long term possible to be sustained, and that more important, that will really benefit our unique patient. Know the population in general, because when we are clinicians, we have one patient at a time, and we need to focus to who is in front of us and his uniqueness or her uniqueness. Floré Clinical has been very kind to allow us to share with you through this screen and codes, barcodes, uh, information that could be helpful for you to understand a little more how to treat patients with obesity. And you can see here the different protocols that are available and that you could be using for your patients. So feel free to take a picture of this or to scan these codes and use them for the benefit of your patients. I want to thank the complete team that was able to create with us these slides and provide us with valuable information. And I want to thank Dr. Fuhrman. It has been a pleasure to collaborate with him, a complete honor to be part of this seminar with him and to be present here with all of you. Thank you so much to the Obesity Medical Association, and wishing all of you good luck again in your new updated practice of obesity medicine, and wishing you a satisfied result after incorporating this new information. Feel free to contact us. We will be more than happy to support you in your new practice and to support your patients too. Thank you so much again.